Um, if you think about it, right, if the sacrum is, you know, stuck, if you define, this is the sacrum right here, right, and the sacrum is like this, right, you should really ask yourself, I wonder if it's stuck this way or can it move, right? That's the $1,000,000 question, right? Can it do this or is it stuck that way, yeah? Yes, right? Because if it's stuck that way, it's a malpositioned sacrum, right? If it moves, it's a sign of stability. You see the difference? That's how you figure out which pathomechanical diagnosis it is. If it's stuck, malposition, if it can move, it means unstable. Right? Right? Yeah?
At what point would this just be the palpation or during active range of motion?
This is why I did step 4.
Okay.
Right? So step 4 is the continuation. Right? So if you're like this, right, you want to see if this side could continuate, right? So that's why we lift up this leg up and see, can it continuate? If it can continuate, that means what? That you're not stuck that way, you're just unstable. If you lift the leg up and you can't move, right, it means you're stuck this way. Okay? Yeah. But the thing is, you know, I hate
So for Jenny,
I don't remember Jenny's situation. Yeah.
Like 2 minutes ago. So she was counter-nutated in neutral, and then she counter-nutated even more when we did the opposite leg lift.
Okay.
So does that mean she's stuck or she is unstable?
She's unstable, right? If it moves, right? Right. Okay. So but we need like more tests than just lifting the leg up test. This is why we're gonna do the next test is the sacrum mobility test. Sacral mobility test, which is really an accessory testing. Yeah. Oh, everything's over here. In case you want to follow, it's in a breakout part here.
Okay, so what you were just talking about was the active simulator race.
Nope.
Oh.
Yeah. I haven't started yet. So, this part.
Move right along.
Okay. But does everybody? So what we're doing right now is literally we're testing this. Right? That's what we're testing, right? Yeah. That's yeah. Okay. And why are we doing this? Because we did active range of motion. Now we need to do passive range of motion. Also, when you do this stuff over here, you're doing osteokinematics, right? Whereas now when I do this is orthokinematics. Right? You guys know the difference between osteo versus orthokinematics?
Yes.
Oh, okay, right. You guys look at me. What? Okay. So, that being said, right? This is why we do this test, right? It tells us orthokinematically what's going on, right? And when you do orthokinematic tests, you're testing what? If it's too stiff or it moves too much. Alright, so this is why we do this regardless if it's regardless what happened during the story testing. So far so good? Okay. So I need to assess this, okay? So traditionally it was taught like this. Lie the person prone, right? And then you take your thumb, and you push the sacrum, right? And try and see can the sacrum move. You go to the superior pole, middle pole, and inferior pole. Right? The problem with this is that when the person lies in prone, they tend to what? Go to an anterior pelvic tilt. When you go to anterior pelvic tilt, the sacrum tends to nutate. Okay? Right? And we learned that nutation is the what? Most stable position.
Oh,
That's
sure.
the closed packed position. Right? So why is that important? You shouldn't assess motion in the most stable position because everything's going to be stiff. Yeah? So this is why we have to test it in a neutral position. Hence the reason why we put it in supine. Okay? It's good to know why we do it because you might have a CI, so why would you do this instead? But then everything's going to be stiff. Okay.
So we have that issue. How do we explain it? Can we crack
Oh, that's a whole different class. But the thing is, the worst way to do it is, well, Dr. E said this, right? That's the worst, right? Okay? You have to say it in such a way in which that you are saying, hey, this is how we learn it in school. I was curious as to, what your thoughts are. That's what it comes down to. And at the end of the day, you have to do what the CI wants. Okay?
Yeah, Marcelo says don't be a pain in the ass.
Oh, don't be a pain about right? You guys are CIs, right? You don't like when students come and say, oh, I learned this way, right? You like that too? No. I know you messed up that, right? Okay. Alright, so anyways, I need to test the sacrum, okay? So here's the tricky part, right? When you're doing this test here, we're not testing the sacrum moving on the ilium. We're going to test the ilium moving on the sacrum. It's the same thing. Okay? So what's going to happen is that I'm going to hold his sacrum. Why is he? Narrow. He has a he, right? Alright. I'm going to hold his sacrum from the bottom, and I'm going to move the pelvis. Okay? So once again, essentially, I'm holding this guy, and I'm doing this. Okay? So does everybody understand conceptually, right? Holding this, and I'm going to do this. Okay?
I have a question.
Yep.
How come just having them against the table, do you have to have your hand there, even though you're feeling for movement here? How come the table isn't enough support to just support the sacrum? Is that a stupid question?
No, that's what we'll talk about next, actually. But before we do that, I'm going to talk about something else, right? Yep.
Are they supine or?
Supine.
Yeah.
So, when I'm assessing motion, right? Everybody look this way right here, right? This is S1, right? This is S2, S3. So we're assessing S1 motion, S2 motion, and S3 motion. Okay? So S1, S2, S3. Yep. Anthony, yep.
Can you show me, show us where exactly your hand is on?
Or we're not doing that part yet,
Okay.
right?
Okay.
Remember, you guys are going too far. You have to understand theoretically what we're doing first, right? I want you guys to understand that we are testing this, this, and this, right? And then the thing is, it's a small motion. Very, very controversial, right? Whether SI can move or not. A lot of people believe that it does not move. Some people do believe it moves, but it moves too little to be of significance, right? And there's so much research to show that it does move, right? And also, if it doesn't move, why wouldn't this be just a fused bone, right? So it has motion for a purpose, right? And the fact that it moves so little, some people say, well, who cares? When it moves so little, it can't be that significant. But then if you think about what does the SI joint do? Its job is transmitting weight from the lower half to the upper half. So any malfunction here really causes a lot of pain. For those who have SI pain, you know what I'm talking about. Okay? So that being said, we're testing small motion. Okay? Now the tricky thing, sorry, make sure everything's okay. Oh, congratulations, you got 10 pig feet. Or shop rights. For Dr. Guell's class. 10. Okay. So everybody understand conceptually, our goal is to test this, okay? This thing is so complicated because when you look at the joint, right, it's the surfaces are not like this, right? It's like this. Why is that important? When I get the person, it's about the line of force. So when I do this, right, I'm not pushing this way, I'm pushing it this way. Right? See that line of force? If I push it straight this way, everything's gonna feel stiff. You're just jamming the joints. You have to go along the angle of the joint. Yeah? But, this is such a horrible test, right? Because so many things could go wrong. The other thing that could go wrong is that you see the joint surface, it's like this, right? Every person's different. Some people are like this. Some people are like this. Some people are like this. Some people, in the Diane Lee book, you'll see one side's like this, the other side can be like this. Okay? So, what does that mean? When you're doing you push this like this, right? You have to push at every possible different angle to see where the line of force is. Because wherever it moves the most tells you that's the joint line. Alright, does it make sense conceptually, right? Right? So like right? So these measure the two joint surfaces, right? And this is the sacrum and this is the ilium, right? This makes sense pushing this way because the line of force this way. But if you like this and you push, what are you doing? You're just compressing it. So what do I have to do, right? I move my hand like this, and now it's moving. But I have to keep figuring out which is the line of force. Okay? Yeah.
You know how when you were talking about going from S1, S2, S3?
Oh, no, not yet.